We're both senior clinical negligence lawyers, and we have both in recent years been increasingly involved with some really quite traumatic maternity claims, and we've seen tragedy after tragedy and scandal after scandal emerge across the UK over the last decade or so. We're talking here about awful circumstances where people have lost their little babies unexpectedly, avoidably, unnecessarily, due to poor care. We have seen an increase in claims over the last decade or so. Donna Ockenden is a very senior and very well-respected midwife who's carried out an independent investigation at Shrewsbury and Telford hospitals. But it's really important to remember that, to begin with, this started with ordinary families who'd lost their babies in the most awful of circumstances, having been given the brush off by the trust, getting together themselves without any help, talking to each other, and then putting together an action group and eventually getting help from other agencies like specialist lawyers and journalists. And that led, after some considerable time, to the Donna Ockenden review and investigation at Shrewsbury and Telford, where independently she identified a number of very significant failings on the part of the trust that had led directly to a large number of babies avoidably dying or being seriously brain injured. And now we have Donna Ockenden again conducting the most wide-ranging review. We very recently heard that 100 of the cases have been referred for a police investigation. That's the level of seriousness that we're talking about.
If a family has been affected by these sorts of issues, then they should get in touch with a specialist clinical negligence lawyer. It's really important to have somebody who specialises in the field, because only specialist lawyers can assess, ask the right questions, assess the evidence properly and advise the client properly about whether or not there are grounds to bring a claim. In terms of the review, the review is still open for new families to join the process, and they can get in touch with Donna Ockenden directly. So, of course, the ultimate goal is that there are changes that are made to make maternity services safer for families and for patients. But obviously, sometimes things do go wrong, and it's important when things go wrong that a proper investigation is carried out, and really importantly the families are listened to. And one of the key parts of the Donna Ockenden review is that when she completed Shrewsbury and Telford, she found that families weren't being listened to. It was one of her key findings. And so what we can do at Nelson's is we will speak to families, we assess their cases, and we listen to them and help to find justice for them, because finding answers to the concerns they have is so important to them. And often compensation is not the driving force for them. They're really looking for answers to the concern they have about their treatment.
The role that we play as specialist lawyers is really important. It allows people to be able to take their case forward with specialist representation. This is a very, very complex area. It's really quite difficult, and people are often traumatised. They are up against the NHS. They really do need and deserve access to justice, which means specialist representation.